I am meeting with Dr. Rebecca Poet today from the Women's Health Hormone Clinic in Brighton, and we are talking today. Have a question that you would like to ask Dr. Poet, or you want to find out just more about it, then please send your messages in to us today. There we go. Hi, how are you?
I'm good, thank you. How are you? It's really nice to see you.
Really well, thanks. Good to see you again. It's been a couple of months now, hasn't it, since we chatted last?
Nice to be back.
Yeah, it's good to see you. Thanks for joining us. We've got lots of questions to get through today. I know that you're always on a time constraint. You're a busy lady. But I just wanted to very quickly introduce you for people who haven't met you before, just to say that you run an excellent private clinic down in Brighton, and that you deal with all things menopause related. So for people who find it very difficult to get an appointment and they're in a bit of a desperate situation, as many of us have been, and you really need to talk to somebody about menopause related symptoms, you offer a private one-to-one appointment on the phone or in person, and they can contact you through the website.
Not in person, we're all online. And so actually, although we are based in Sussex, we've got patients all over the country. So location is not a barrier, it's all online. And it's actually any hormonal problem from the age of 18. So lots of menopause, lots of perimenopause, but also other hormonal issues. So yeah.
Perfect. Well, today we really wanted to concentrate just on vaginal estrogen, which seems to be quite a hot topic at the moment. And I think there's a little bit of confusion. I know I'm sort of confused about if you're already on HRT, do you take that as well or instead of? And what are the rules around that?
Absolutely. So vaginal estrogens are really, really important. And I would say they're important for all women. There's a very small minority of women who really can't use vaginal estrogens, who've potentially had hormone-dependent cancers that really have to stay clear of hormones. But really, all other women, whether they choose to use systemic estrogen or not, in my opinion, should use vaginal estrogens, because taking care of the vulva and the vagina is so important to long-term health. It impacts continence, it impacts sexual functioning. It really is a vital piece, and just because you're on systemic HRT doesn't mean you won't feel the benefits of a localized vaginal product as well. So, and I think that is where people get a little bit confused. They think, I'm on my patches, I don't need anything else.
So sort of, I guess my thinking was, well, if you're on the patches, why would that estrogen not kind of cover that area as well?
So I think for certain women at the beginning, it can be enough. So they don't notice symptoms of vaginal dryness or urinary symptoms initially when they start their HRT journey. But as time goes on, the local impact of low estrogen levels on those delicate tissues just mounts up, and it affects all sorts of things. It affects the pH of the vagina, the loss of elasticity of that tissue, impacts kind of how robust the environment is. It changes the microbiome within the vagina, so you can be more prone to things like urinary tract infections, things like bacterial vaginosis, because the pH change, the vagina becomes a more alkaline environment, and those kinds of things can be more problematic. So actually dealing with the estrogen levels on those tissues at source is really helpful in settling those things down and kind of putting things back to normal.
Yeah, okay. So what would be the most sort of common symptoms that somebody might present with for you to say, I think you need to have vaginal estrogen?
So often they've noticed things are just drier. Some people are aware of a persistent discomfort. They really are. You know, when the vagina is healthy, we don't really know that it's there. We're not aware of it. Whereas people can have an awareness of a discomfort there all the time. Or it might just be something that plays during intercourse. The intercourse is suddenly not very comfortable. It can be frankly painful. But for some women, it's just not quite as comfortable as it used to be. Maybe symptoms like urinary frequency, or going backwards and forwards to the GP, going, it's burning my wee, but they do a urine test and there's no infection there, and we're like, well, what's going on there? Actually, there's not a urinary tract infection there, but it's burning. Why is that? And actually, very commonly, it's because the skin condition's changed. It's very delicate. Urine's is chemical, so if it's on delicate skin, it burns, and so that can mimic urinary tract infections as well. So,
wow, okay, so lots to think about. So I guess my sort of brain is saying, why wouldn't everybody have that as opposed to just the patches or the gel? I mean, is that something?
That's a really good question. Yeah. Why doesn't everybody have it? Interestingly, you can now buy a pessary of vaginal estrogen over the counter in your pharmacy. So that is how these products that we use locally are very low dose. They're very gentle. There is a little bit of systemic absorption, but very, very little. So they're felt to be very safe when used alone. Hence, you can actually buy the pessary over the counter if you don't feel like you want to go and see your GP, if you're embarrassed to ask. So that is how safe they're felt to be. But yeah, quite right. Why are all menopausal women not using these? And why are all women later in life, even if they don't choose to use HRT, using these? I think we would see much lower incidences of incontinence, bladder issues, general discomfort in older women if we did use them.
Yeah, absolutely. That's a great point. I mean, I was just renewing my prepaid prescription today actually for HRT, and I was wondering whether that would be included, because I know that somebody said to me testosterone isn't included, for example.
So the prepayment certificate's very clear. It's for hormone replacement products that are licensed products. So testosterone is not covered by that. Currently, there is a licensed product appearing on the market, but that hasn't changed. But yes, your vaginal products would be included. And it's really important because I think now a lot of our regimes for HRT are separate. So you have a patch and you have a progesterone tablet, and then we're talking about a vaginal pessary and a cream. That's 4 items per prescription. Really adds up. Would all be covered by your NHS prepayment certificate.
Oh, that's really good to know that, because it really wasn't clear on the website what was included and what wasn't. So that's great that you've clarified that.
That's all included in that £20. So
yeah, okay. So I mean, I was reading briefly around vaginal estrogen, trying to understand how you apply it or use it, and what sort of formats does it come in?
So there are various products. The most common regime that we recommend is a 2-phase regime. So we recommend a pessary that you pop into the vagina that dissolves at night, just like one of the thrush pessaries that people might have used in the past. But you pop that in and it dissolves overnight very gently. So that treats the internal area very effectively. We then also recommend, there's a cream that can be used internally, but it comes with a refillable straw. So it's really quite messy to use internally. It's quite fiddle. It's quite hard to clean that straw. But we really like that because you can apply it to the vulva, because we often neglect the vulva. People often don't even know what the vulva is. It's the external bit. And you'd be surprised how many people talk about their vagina and they mean their vulva. So the external area, if you treat that area as well with a thin layer of the cream, that can help to deal with any discomfort that you might be feeling externally if you're wearing tight jeans or leggings, or people that cycle, that they feel discomfort. But it also treats the clitoris, which can literally atrophy away. So if you don't keep that healthy, then sex isn't going to be as satisfying as it would have been. So treat the clitoris, and also treat the area around where the urethra opens, so where the urine comes out, because if that area gets delicate and thin, that's when you're going to be again run into trouble with urinary tract infections or with irritation when you wee. So really important to use the cream externally and the pessary internally. And I think that's sometimes something that gets missed. GPs give one product, but you're treating one area. The pessary doesn't effectively treat the vulva. So we would say treat both with 2 different products.
And is that a daily application, or is it like the patch, twice weekly?
So initially, we want to kind of give you a boost. So when that tissue has become delicate, we want to give things a boost. You treat them very regularly usually we say for about 3 weeks. So every night for about 3 weeks, put on these treatments. And then you drop it down to the minimum number of nights a week that maintains the response for you. So for a lot of women, twice a week's perfect. So if you're on a patch, do your products on a patch day, a change day, and that is enough to keep things at bay. But you don't stop entirely. You just drop down to that couple of times a week. Other women, if they go to twice a week, they're like, oh, actually, I'm a bit uncomfortable again. They can go every other night potentially. And if that sort of as our kind of standard regime isn't sorting it, there are other options. So there is a DHEA pessary. So it's not estrogen, it's a different hormone, but that can be effective, and it's used every single day. So some women respond well to that. There's also a ring, so something called E-string, and that's a little plastic ring that is popped up into the vagina. It stays there for 3 months and it steadily reduces estrogen all month. And a lot of people who find these other products a bit messy or they're not effective, they need something steadily going, really like the E-string. So that's something lots of people haven't even heard of. And that can be
I've
really,
never even heard of that.
yeah,
That's, I mean, this is how sort of, I mean, we're obviously in the business of knowing these things.
yeah.
But yeah, so what would your sort of first line prescribing be for the vaginal estrogen?
Typically, it's a pessary and the external cream. So those are my two favourites. And there are two types of pessaries. The actual pessary is exactly the same, but some people have been given Vagifem, and Vagifem comes preloaded into an applicator. And so every time you use it, you chuck the applicator away, which from a green sort of ecological perspective is not great.
No.
Vagirux is the same product, but it comes with a reusable applicator. So each pessary is wrapped and you get one applicator, but you don't actually really even need the applicator. So a lot of women just prefer to pop it in with a finger, just ignore the applicator entirely and just pop it in themselves. That's generally a gentler way to use it. But those would be my first choice, kind of. And then the cream is just one cream that we use, and it's, you know, there's no choice with that, but it's a nice, gentle, easy to use.
Yeah, and that's a sort of treatment that you would, a bit like the HRT patches and the gel, that you would use for life.
Yeah, yeah. And so your HRT, your systemic HRT, some women use it for life, some women use it for a defined period. There's an annual review, you have an annual discussion. For some women, it's right to come off in 5 or 10 years, or that's a very individual discussion. But I think for basically all women, apart from that group who have had a hormone-dependent cancer, where we have to be super, super careful about any additional hormones, then yes, I would recommend they carry on for life. And actually, some women who have had hormone-dependent breast cancers who really struggle with their vulvovaginal symptoms, it is now feeling appropriate to use those. So in some women, we do still use the hormonal treatments because they are such low dose and so localized. But that is a more in-depth discussion and unlikely to be something that a GP would want to, okay, they would want somebody higher up or more specialized to decide in that scenario.
So it's not a case of, you know, I mean, I think I'm on 100 milligrams of the patch, which is probably quite high. So it wouldn't be a dangerous thing to add that in, because it would up the dose of estrogen just too much.
Absolutely not. No, because it's a very localized effect. So the cream is actually a form of estrogen that's much gentler in general than the patch. It's called estriol. It's not the same as what's in your patch. The pessaries are the same hormone as in your patch, but no, it's a very localized impact. And to put it into perspective, if I've got a lady who isn't using HRT, but she's menopausal, she still has a uterus, we can use vaginal estrogens without any second hormone to protect the uterus. So it's very clear that it's that safe. So you can use vaginal estrogen alone with no other HRT very safely. So we're very confident about that.
Gosh, there's so many ways that you can get estrogen into the body. I know in the US, I think it's orally, it's more popular, isn't it? Which seems to be less popular here. And sort of that's supposed to go everywhere in the body. So it's very confusing where you should be concentrating.
And even if you're on oral estrogen, so if you're on an oral estrogen tablet for your HRT, we would still recommend vaginal. And in the US, they would still recommend vaginal treatment. The reason we use less oral estrogen is because it is associated with an increased risk of blood clots. It's a very small change, but when estrogen is given by a patch or a gel or a spray, there is no change in the clotting risk. So it's the safest way to give estrogen. But we do still use oral estrogen in women for whom that's the right choice, again with a proper risk-benefit discussion. So that's a really individual decision. So we do still prescribe that, but estrogen through the skin is safest.
Yeah, so I guess on a day-to-day basis, your most common things would be the patch first and then the gel, maybe, or
very variable. I would say patch and spray are my personal sort of first choices. I definitely recommend patches to migraine sufferers because I find migraine sufferers do better with a nice steady state absorption. Beyond that, I really in the first instance go on patient preference between gel, patch and spray. What do they like the sound of? And often that's great. And sometimes they go, I'm really desperate for the patch, but they don't get on with it. And then later on they do switch to something else because actually it's not worked well for them. So, but it can just be about personal preference.
I know in the winter we hear lots of ladies say, oh, the gel is so cold because you've got to sort of leap around doing star jumps trying to get it to dry before you can
I
put your
know.
clothes on.
It's really annoying that they haven't made, the pharmacy companies need to make us a more concentrated estrogel so that you could use one pump or even two. It would be really handy. But unfortunately, they haven't caught on to that yet. Maybe if it was for men, they would. But at the moment,
Watch
we're
this
waiting for
space.
that. Yeah, it would be great because it would be so much easier. And you go through less bottles as well. You think, oh, plastic
Absolutely.
bottles.
I know, because I mean, I know I have the testosterone gel as well, which, even that is a tiny little pea size amount, but you've got to still wait for it to sort of
Yeah.
soak in before you can put your clothes on.
Yeah, it's all these practicalities of prescribing. So there are other products available. There are things that can be compounded to work for you. So but that's not in mainstream NHS on your prepayment certificate type of hormone products. So they're not always accessible to everybody. So it'd be really nice if the mainstream drug companies would come up with some products that are more user friendly, given that there's been such an uptick in use of HRT in general. It would be
Yeah.
nice.
That's right. Well, I mean, it's a good thing, isn't it, that more people are able to get it and are feeling better for it. That's got to be a good thing because
And that's where we're going to see changes in long-term health outcomes from fewer heart disease risk and better bone health. But the conversation started now. So now it's good that the vaginal and vulval conversation is starting. People are used to talking about their HRT, so now they're starting to talk about their vaginal dryness and other things. So that'll change. But then we hope, it'll push drug companies to make things which are more palatable for women to use.
Yeah, that's right. Because I suppose with the creams and stuff, when you're using those, can be quite messy. So is that a nighttime thing? You would do that before you go to bed, or?
Definitely. Last thing at night is really important. Then you're lying down, it all melts in nicely. And also important to know, don't put your pessary in and then go and have sex. Do it the other way around. So
Right.
it's not advisable repetitively to do it that way around. So always better to kind of try and use those after you've had sex or on a night when it's not going to happen.
Yeah, because I suppose that's a very genuine risk that
Yeah.
you're passing that estrogen onto your partner or husband or whatever, and that's not a
And
good
I
thing,
think
right?
it's kind of common sense that would not be the best thing to do. I don't think there's been lots of studies looking at the actual impacts of that because nobody's going to want to be the person to have to try that. So it's quite a hard thing to study. But sense would say, don't put something that's going to absorb really slowly over the following 8 hours into your vagina and then have sex without you wouldn't want to have sex with a condom on anyway if you had creams and things in there, but it's just sensible, I think. It's like washing your hands after putting on your testosterone. It's
Yeah,
just
but that is a very
sensible thing
real
to
risk,
do.
isn't it? You don't want to be
Yeah.
giving your partner man moves or
No,
too
no,
much estrogen.
no, exactly. But it's the kind of thing you think, okay, what people do say, what order do I do things in? It's like, well, let's just think about it sensibly. And
There's
then
a lot to think about, isn't
yeah.
there?
Yeah, absolutely. There is.
Life used to be really simple. You'd get up and go, and now it's like contact lenses, gels, creams,
Yeah.
pessaries, whatever.
Yeah, it definitely is. And it's more complicated now that HRT has been separated into natural progesterone and natural estrogen products, which is better, but it's trickier. It does take more thought and planning and routine for the woman. So
So actually, I'm glad you mentioned the word natural because that was another question that we had. Is there an alternative sort of natural remedy, or is it
to
only?
dealing with the giant, you mean not hormone free?
Yeah.
So there is no natural way to improve the tissue density, robustness, and actual function of your vagina from the estrogen deficiency point of view. But there are non-hormonal ways of dealing with the symptoms.
Mm-hmm.
And actually, even women on the hormones may well find they need some of the non-hormonal things as well. So by that, I would mean a lubricant, which is meant for intercourse, but also a moisturizer. So there's a difference. A lubricant is something you use just for intercourse to prevent friction, but a moisturizer does exactly what a moisturizer does to your face, which we're all very familiar with, spending lots of money on things we put on our face. So a moisturizer can be really helpful. Use any time you're feeling uncomfortable. Use it in the morning, use it in the middle of the day, at any point. Some people find externally coconut oil is actually comfortable for the vulva, and that's a very natural way to just mean that the vulva feels less irritated. It's not going to change the density of the tissue, but it can make things feel more comfortable.
And
And then
that's
also,
safe to use, is it? That's
and a nice coconut oil that's just been kept in the bathroom, just put on externally. I wouldn't be putting that internally, but externally can just make things feel more comfortable. There are products available to help with the pH balance of the vagina. So there's something called Balance Active, which is a product that is a gel. You pop it into the vagina and it tries to recorrect the pH balance. So women who get lots of bacterial vaginosis find that Balance Active is good all the way through their lives. But if you really were struggling with that kind of irritation, and then you didn't want to use vaginal estrogens, then Balance Active is a product that could help with that. So
and how do you know if your pH is out? I mean, what are the signs or symptoms that you would notice?
a tendency to having what people think they've got thrush, but they haven't actually got thrush. So they have a swab and they haven't got thrush. Getting what bacterial vaginosis, which is a bit like thrush. It's not an infection. It's an imbalance that allows bacteria to grow, which is thrush is where a yeast grows. So whereas bacterial vaginosis is where bacteria grows, and it happens. But it's not something you've caught. It's not an STI. It's just from an imbalance, and that happens more commonly when the pH has changed. So you find you're more irritated, maybe getting a slightly strange smell, a fishy smell after intercourse, a discharge, but that's not the normal, change in your discharge. So those kinds of things you'd pick up if you then went to your GP and they did a swab. They might come back and say you've got bacterial vaginosis, which needs treating with an antibiotic. But a way to prevent that from happening again is to get the pH right within the vagina. So something like Balance Active would be helpful in that scenario. But vaginal estrogens would be good.
And so a vaginal estrogen would regulate the pH.
Yeah, it helps to improve, helps to resettle the pH and the microbiome back to what it was before. So
wow, so lots of good reasons to use it, really.
Yeah.
And so what, in terms of the things that women present with most commonly when they talk to you on the phone, is there anything else that we should know about that we're missing, the layman needs to know?
In terms of menopausal and perimenopausal symptoms in general?
All of it, really. Yeah, I mean, today you've obviously highlighted that vaginal estrogen should be something that everybody takes. I've never heard that, my GP's never said that to me.
Yeah, I think everybody should end up on it. As I said, sometimes at the beginning of your perimenopausal journey, you don't really have those symptoms. They haven't kicked in yet. But I would say that they are the thing that if you don't treat, even the women that sail into menopause with no symptoms, who do exist, there are women for whom perimenopause is not a bother. With time, as their menopause progresses, they will develop vulvovaginal symptoms. That does come to everybody. So that is, there will come a point where I believe all women should be using them. Might not be right at the beginning of your journey if you have no symptoms at all, but knowing what is likely to present and getting ahead of it when it does is key. Other things people don't want to talk about, I suppose. Lots of people say they've got low libido, but people don't always then talk about, well, actually, if I am having sex, it's not as satisfying as it used to be. It's less satisfying, it's harder to be engaged in it, it's physically less comfortable. So those are really common things that with a bit of teasing out, people often talk about. So they'll say my libido's low, but then it's like, okay, well, if you do, does it feel the same? It's climaxing the same? Is it as comfortable as it used to be? So those are really common symptoms which people present with. Then it's mood change, anxiety, sleep change, insomnia. Insomnia in perimenopause and menopause is a really difficult problem and very, very common. So I think that's another thing people don't always. I think it's life's keeping me awake, but actually sometimes it's hormonal imbalance as well, contributing to a cycle of lack of sleep. So.
And that can be so debilitating, can't it? Lack of sleep, everything gets out of shape pretty quickly.
Horrendous. Yeah, definitely.
Yeah. Okay, that's a whole other subject that I'd love to do with you another time. But I know from speaking to friends, it's like such a delicate balance of all these things that we take and trial. And I know that she was taking testosterone gel and went too far the other way. That was, her husband had to ask her to stop taking it in the end.
Oh, really? It's exhausting him. Absolutely. You've got to always get, it's finely tuned, and also that's key, isn't it? It's got to fit to your relationship and your environment and your life, and that's the same with all of these things. You've got to get it right for you.
Yeah, absolutely. That's so funny. Okay, well, I think I've pretty much covered all the questions that we had in today, which has been amazing. And I'm conscious that I've almost had my half an hour of your very precious time.
No, you're
But
welcome.
just if anybody wanted to contact you, having watched this, and they really want to talk to you on a telephone appointment, how do they go about doing that?
So they can go to our website, which I believe they can click on a link to take with a women's hormone clinic, and they can contact. There's direct booking. It's actually video consultations, so they can book directly through the website. That's some of our appointment times are on there, but actually we've got a lot more availability if they want to contact the inquiries line. There's an email address, our phone number on there, and they can. The admin team are really happy to slot them in. And there's actually 5 of us in the clinic, so they can pick. We've got our little profiles on the website, so they can see who they think they might fit with best and ask to see that person.
Perfect. That's brilliant. And just before you go, I just wanted to share with you that our new formula for Nudie Spray has just arrived.
Amazing.
And the reason we've changed or upgraded the ingredients is because Everel glue was becoming more of a nuisance. I don't know whether they changed the glue formula. Something's changed. And so we've had to upgrade our product, which is it's a richer spray now. Just to break down the glue bond and remove it from the skin. So we will definitely send you some new samples of that.
I had a patient today who said, "Oh, I've got Nudie, but it works on my estradiol. It doesn't work on my Everel." So I will get back to her
there we go. I'm going to have to send
in
you
fact,
some.
if you're sending some samples, I know exactly how I need to pass it on. That's really, I hadn't heard it. So yeah, amazing. Oh, it's great. You're one step ahead then. That's lovely.
Yes, we're always trying to keep up and stay ahead.
Oh, that's amazing. Oh, well, great.
Well, it's lovely talking to you, Rebecca. It's good to see you again. And we'll share your details at the end of the live so that people can see where your clinic is and how to contact you.
Perfect. It's an absolute pleasure. I'll come back anytime.
Lovely. Lovely to see you. All the best.
Nice to see you. Bye.
Take care. Bye.